Here surface marking has been done. This is lateral end of clavicle, this is acromioclavicular joint, and this is coracoid process. This is acromion process, this is its posterior border, and from posterior border of the acromion process it is continuous with the spine of scapula. Now come 2 cm below and medial to the posterior border of acromion process and mark this point, or even we can feel the joint space. Now clean the skin with local antiseptic solution and now aiming towards coracoid process. Aiming towards coracoid process and in anteromedial direction, pass needle gently and it should go resistance free. Now after passing needle, aspirate, see if any blood or fluid and start injecting slowly. The injection material should go resistance free and smoothly. Inject it slowly. Now after injection again I will aspirate, and if injection material comes we are in right place. Now clean it again and apply a plaster over here.